All right, well, let's go ahead and get started then. Again, thank you so much for those of you who have signed on to this webinar today. We welcome you to this conversation, and we're really excited to introduce a really wonderful new resource for all of us who are working to enhance the response to sexual violence as well as to prevent sexual violence. The National Intimate Partner in Sexual Violence Report, which we will affectionately refer to from now on as NISVS, and that's an acronym that we'll all be getting used to. But this was issued in December of 2011 and has been eagerly awaited, and we're hopeful that through this webinar will be helpful to you to help you think about ways to use this in your communities to expand and enhance the knowledge that your community members might need to have in order to understand the really critical work that you do, both in intervention and prevention. I'm Donna Dunn. I'm the director of the Minnesota Coalition Against Sexual Assault. And with me today is Roberta Gibbons. And Roberta is, as you probably all know, she was at Aurora Center at the University of Minnesota for a number of years, and is now in the past year been working with Metropolitan State University. And she'll probably, if she needs to add more for an introduction, we'll let her do that when I turn over the program to Roberta. I am very happy to have Roberta doing this webinar with us today, and in fact, she's going to be doing a lot of the heavy lifting on the webinar. She is much more adept at talking about research and at some of the information that's come out in the NISVS report. So I'm very happy to have her with us today. Again, make sure that you have muted your phone if you haven't had the opportunity to do that. And we're going to go on right now with what is NISVS, and I'm happy to turn over the microphone to Roberta.
Great, thank you, Donna. And hi, everyone. Thanks for joining us today. I'll just leave my introduction as it has been and get right into what's going on with this research study. The first word that you see there under what is NISVS is the word ongoing, and certainly NISVS the plan is for it to be an ongoing and nationally representative telephone survey that collects information about sexual violence, stalking, and interpersonal or intimate partner violence. However, this is the first year of the study, so when you see the word ongoing, just know that this is the first year. There are several other studies, and we'll mention a few of them later, that have been done in the past that look at these same issues, but this is really the first study where the plan is to continue collecting the information and the data annually from here on out. The study asks questions of people to discuss both their lifetime experience and their experience in the past 12 months that relate to sexual violence, stalking, and intimate partner violence. They began interviews, telephone interviews, with 18,000 people for this study. It's the largest study of its kind, and actually about 16,500 people actually completed the survey. So it's a very large survey. It's definitely a nationally representative sample, and people from all of the states were included in the sample. The data that we're going to be talking about today is from adult men and women in the U.S., and so it's from people 18 and older. It asks them about experiences, however, that happened to them throughout their lifetime. So some of the experiences reported will be things that happened to them before they became adults. As I said, this is the first year of the study. It gives us what we call baseline data, and actually I think the first couple of years will probably be considered baseline data. And what it's really going to let us do is to track trends. A lot of times when we read reports in the newspaper that talk about, incidents of rape or incidents of other types of violence going up or down, they are most often based on crime reports or police reports. And so this is going to be the first data that's based on experience rather than police reports that will allow us to actually track trends nationally and state by state with regard to the types of violence that the survey focuses on. And so hopefully with this survey, it will be able to monitor the magnitude of the crimes in the U.S. from here forward.
This is Donna again. We'd like to talk a little bit about how NISVS framed their reason for doing this. And I want to start out by saying that at the very end of this, we do have a link to all of the NISVS data and all of the NISVS materials that the CDC has issued. So if you've not had the opportunity to go to their website to download the summary of the survey, to download the toolkit and talking points, you will have a link to do that. But in their toolkit, they really talk about how they came up with this particular frame. The value that they worked from is the value that they think everyone can probably share and can get behind. This is a really commonly held, or some common ground for all of us, that everyone deserves to live a life free of violence. There's not much controversial about that. The next thing that they did is really talk about, well, what's the barrier to reaching that, to making that value a living value? Well, a barrier they've named is that there are significant gaps in existing data. Okay? So is there a solution to that barrier? What they say is that NISVS is the solution. It has gathered good data with a really strong attention to the public health burden of these problems. So it's bringing both the data together with information about the public health costs. And then ultimately this leads to their vision that when people better understand the nature, the extent of the problem, they'll use that knowledge to strengthen and support prevention efforts. So you can see how then that goes back to the value, which then would be about, in the next slide, would get to this, with improved prevention efforts, respect and nonviolence will become the norm for individuals, peers, couples, families, communities, and society. And that means you get back to their earlier value statement that everybody deserves to live a life free of violence, and that's a way of getting there. One of the reasons that I think it's good to take a look at this framing process that they went through is that you can also use this when you think about presenting NISVS data in your community. Think about what the common ground is, what value statement you're going to work on, what information you want to present to the community, how you would frame what the barrier is and the solution, and how it connects with your particular community. And for more information on that, if you download the toolkit, the communications toolkit on the CDC website or NISVS website, on page 15 to 16, you'll see some instructions for how to use this framing to help you in your own community. Well, as we've seen, the primary objectives for NISVS are noted here. Essentially what they want to do is monitor the magnitude of this issue across the United States. And they're doing that based on data that they've collected from victims, because they've identified, and we all, I think, can probably agree that the victims are more likely to disclose experiences than perpetrators. But here you can see what their primary objectives is: to monitor this, the magnitude of this problem, to identify who is most likely to experience these kinds of violence, to identify the patterns of violence, and then the impact of the violence experienced by specific perpetrators. And then ultimately to focus on the health consequences and the long-term outcomes of these forms of violence on the population. And those of you who hear that will know, that's okay. Those of you who are used to working with the public health model will know that that really kind of fits with the public health model.
Hi, it's Roberta again. And before we move forward looking at some of the results of this survey, we'll throw a little jargon at you and try to explain it. And the first thing to understand is that there's a difference between the prevalence and incidence of a condition. Prevalence is an estimate of how common a condition is within a population over a certain time period. And so generally speaking, that means that for prevalence, we're counting victims. So we're asking people whether or not something has happened to them, whether or not they've experienced a certain thing. And you're going to hear me and perhaps Donna as well use the verb experienced sexual violence throughout this webinar, which this idea of experiencing something is really language of talking about prevalence. However, I just want to acknowledge that I definitely understand that it's not the best verb to use when you're talking about being the victim of a sexual assault or other types of violence. Incidence is you're actually counting the number of things in a given time frame. So, for example, if a person experienced 3 sexual assaults in the last year and they were asked a question about sexual violence on this survey, they would count as 1 because the survey counts prevalence. So it's counting numbers of victims, essentially, rather than numbers of events. So hopefully that makes sense to everyone. This survey was conducted using sort of the gold standard for survey research, was using a random digit dial. One of the things that makes this survey different than many other surveys that ask about these kinds of issues is that it contacted people both with landlines and via cell phone. It also conducted the interviews in more than 1 language, including Spanish, and I talked about the numbers of people that completed interviews already. We will talk about both national and state estimates, and again, this is based on self-reporting by victims. Questions were not asked about whether people perpetrated these types of crimes, and there weren't questions, and results are not based on police reports. They're based on self-reporting by victims. The study defined all of the types of violence that it asked questions about. And I will talk a little bit later about the way that questions were asked, because as you can imagine, in the old days when they did surveys that were related to these types of violence, if they asked someone whether or not they were raped, they got very low numbers, because that would force somebody to self-define as a victim. It would ask them to self-define what rape means, and it would ask them to overcome any of the barriers to admitting being a victim, including probably one of the strongest ones being shame. So this survey asked behaviorally specific questions, but the definitions that were used in this survey in order to qualify or categorize those behaviorally specific experiences were the following. With regards to rape, it included completed or attempted forced penetration, and also alcohol or drug facilitated completed penetration. That including situations where either the perpetrator gave the victim alcohol or drugs in order to render them vulnerable, or if the victim willingly consumed alcohol or other drugs. The survey differentiated between rape and other types of sexual violence. For the first time, being made to penetrate another was a category in and of itself, and each one of these will be defined in later slides. Sexual coercion, unwanted sexual contact, and then non-contact unwanted sexual experiences. So those were all included under this sexual violence category. One of the things that made this survey a little different than some other national surveys that have been done in the last few years on college campuses is that when unwanted penetration was accomplished through the use of coercion, that did not count. It was not counted as rape. It was counted as sexual violence, but not in the rape numbers that you will be hearing about. So coercion is penetration occurring after a person is pressured in a non-physical way, so with no use of force. And you can see that that includes being worn down by repeated asks. So an example would be somebody, somebody saying, come on, let's do this, and someone else saying no, and this going on for an hour, and then finally the person who says no just stopping, not saying anything after that. And so that would be considered coercion. Being lied to or told untrue promises, I'll marry you if you do this, etc., or being threats to end a relationship or spread rumors. and then finally being pressured by someone using their influence or authority. So those all fell under the categories of coercion, and thus were not counted in the rape numbers that you'll be hearing, but in the sexual violence numbers.
And this is Donna. Interestingly, many of those would do fit under criminal sexual conduct in Minnesota statutes, so it's a little bit of a deviation from what we'd expect to see in Minnesota statutes.
Yeah, I would agree with that. And as I said, it's also really different. There were two national studies done, one in 2001 and one in 2007 on college campuses that did include coercion in the rape statistics. The unwanted sexual contact means unwanted sexual touch, but does not include penetration, so it would be like criminal sexual conduct 2 and 4 in the Minnesota statute. It also includes unwanted kissing in a sexual way. And then finally, the non-contact unwanted sexual experiences include, the exposure, the flashing, etc., making someone show body parts, making someone look at or participate in making sexual pictures or movies, so forcing someone to look at pornography, for example, and then some sort of public harassment, sexual harassment that makes the victim feel unsafe. Sexual violence or interpersonal violence included sexual violence as previously defined. It also included physical violence, such as slapping, pushing, shoving, beating, burning, and I put choke in quotation marks because it's really strangling, but the survey did use the word choke because people are more familiar with it. But as most of you probably know, to choke means to choke on something you're eating rather than strangling. But it does, the implication of it is actually strangulation. Stalking, psychological aggression, and then control of reproductive sexual health. One thing that's important to note here is that the physical violence that's included is all sort of included on the same level. So much like if any of you are familiar with the conflict tactics scale, the CTS, the physical violence here is counted as all being equal with one another. So if I report that I've been slapped, I count as 1, and if another person reports that they've been beaten, burned, and strangled, that also counts as 1. So there's some controversy and some issue around this idea that this survey isn't nuanced enough to show the difference between perhaps someone being slapped and somebody else being beaten. Nor is it nuanced enough to tell us whether or not anyone is using any of these measures in self-defense.
So in the key findings, yeah.
Okay, so key findings, sorry, I got lost on the slides there. We know, and no surprise to anyone, that rape and sexual violence as defined in the survey are very common in the United States, and that women are much more likely to be victims of these types of violence than are men. The survey found 1 in 5 women and 1 in 71 men reporting rape at some time in their lives. And as a reminder, this 1 in 5 statistic does not include coercion, nor does it include, in terms of men, nor does it include being forced to penetrate, which is a new category that was established in this study. And also, so if we look, those are lifetime statistics then, 1 in 5 and 1 in 71. If we look in the last 12 months, when women reported on their last 12 months, we see that an estimated 1.3 million women experienced rape during the preceding year.
So, Roberta, is it fair to say then that the rape data can be looked at as probably a minimal number in terms of how people think about coercion and force?
Right, because again, the rape only included rape by force or alcohol-induced alcohol-facilitated or other drug-facilitated rape. So if anything, it's believed that this number, this 1 in 5, is an undercount rather than an overcount, not only because of the definition of rape, but also because we know that in doing surveys like this, even though the people who do the surveys are very well trained and we generally get pretty good statistics from them, we know that there are some people who will not participate because of memories, for example, of their victimization. And so you're more likely to get people to not finish this type of survey if they are a victim than if they are not.
Okay, interesting. Thank you. So the next bit of key findings that we want to talk about is the key findings around sexual violence. So again, this is not the rape category, but sexual violence. And for those of you who received the PowerPoint attachment in the reminder for this webinar, this slide changed just a little bit. I had not included, mistakenly, probably the overall number that I wanted to make sure that you had it available. And what that is that when you combine all of the categories of sexual violence that Roberta had referred to earlier, the data shows that nearly 1 in 2 women, so half of all women, and 1 in 5 men have experienced a form of sexual violence across their lifetime. What the survey talked about was that probably 1 in 21 men were forced to penetrate someone else. We see data that says 13% of women, 6% of men have experienced sexual coercion. This includes penetration, but not force or threat, as we heard before. And that a significant number of women and men have experienced unwanted sexual contact, which we said, and that would be 27% of women, 11% of men. Again, remember that this is self-reporting, and again, doesn't carry, well, I guess the issues of nuance have more to do with intimate partner violence. Again, if you wanted to see some of this data, and I have made a note here, I'm not entirely sure why I wanted you to know this, but you can find this on page 19 of the summary report. One thing that I wanted to say is that oftentimes when we talk about sexual violence in these kinds of categories, when we're not talking about force, I've been challenged by people who say, well, why do you call that violence if we don't see any overt violence being used? And that might be an issue that comes up for you when you talk about this category. The response that I've commonly used is that when a kind of activity ends up harming somebody emotionally in terms of the health outcomes that we'll be talking about in a little bit, when harm is done, it appears to me that what has happened is violence has been used, even though it may not look like the kind of violence that people envision when we think about somebody using physical force or a weapon or multiple perpetrators to render somebody unable to protect themselves. Sure. We've got a question. Does the unwanted sexual contact only include touch incidents, or does it include non-touch events? You know, there is a section of I think it only includes touch. And I'm looking at Roberta, and she's nodding.
Shaking my head.
Yeah.
I never see that.
Yeah, so she's agreeing. Yes, it only includes touch, but there is the other category that includes the non-touch, the harassment, and tell me, I think it's called non-touch. It was a definition that Roberta just kind of went through, and I'm...
Non-contact, unwanted sexual experiences.
There we go. That's the phrase that just rolls off the tongue. Yeah. Okay. And I think were you gonna take this one, Roberta?
Sure.
Okay.
And so when we look at IPV being intimate partner violence and stalking, we see again that women are more likely to be the victims of these types of crimes. 1 in 6 women and 1 in 19 men reporting stalking, and a third of women and a little over a quarter of men reporting that they experience physical violence at the hands of an intimate partner. And then 1 in 4 women and 1 in 7 men reporting that they experienced severe physical violence by an intimate partner. And again, these numbers, I think, for some people look high for the numbers of men. Again, I just want to remind people that the scales that were used were scales that showed that being slapped or pushed or something like that was equal to and counted as much as being beaten, burned, or strangled. So that's one of the reasons why we see these numbers a lot more close, with 33% of women and 28% of men reporting experiencing physical violence. When we get to the impacts of the violence later on in the presentation, you will definitely see that the impact of the violence is very different for women and men. On the next slide. This next slide talks about, you need to think about it a little bit differently than the other slides. The title of it says, or the subtitle says, rape and sexual violence are most often perpetrated by someone known to the victim. And that is nothing new. We've known that from other studies and from our work as well. But the data on this slide, you need to remember that the starting point for this data, or the starting population, is everyone who reported a rape. So of everyone who reported that they had been victimized by rape, more than half of the female victims reported that they were raped by an intimate partner. So that 51% doesn't mean 51% of women say that they were raped by an intimate partner. It means 51% of those who reported being raped were raped by an intimate partner. The same is true of the remaining data on this slide. Almost 41% of women reported being raped by an acquaintance. That is true of all those reporting rape. About 41% were raped by an acquaintance. And for male victims, those male victims who reported being raped, over half of them also reported being raped by an acquaintance. And finally, of all the men who reported being raped, 15.1% reported being raped by a stranger. Okay, so again, this isn't a big surprise to any of us, but we know that this type of violence starts very early in people's lives, and we know from other surveys and other research that being a victim early in life greatly increases your risk of experiencing this type of violence later on in life. So this study found that about 80% of female victims experienced their first rape before the age of 25, and about half of them experienced their first rape before the age of 18. We also know that about 35% of women who were raped as minors, so before they were 18, were also raped as adults, and that's compared to 14% of women reporting rape who did not experience the early rape. So this survey adds to the data of other surveys and other research that has been done that does show that this early abuse against children and teenagers is definitely a risk factor for being a victim as an adult. We see that almost a third of men, or between a quarter and a third of male victims, experienced their first rape when they were under 10 years old. Earlier data told us, although it was data based on crime reports, that the age at which a male is most likely to experience sexual abuse is 4 years old. So we know that this is something that happens to boys at a very high rate.
And it appears as though it appears as though the incidence of rape early in females' life goes for a longer time span than earlier in a male's life. And is that because as males mature physically, they're less? I guess that would be speculative.
Yeah, I think that's a good question. I don't think we really know why, but a lot being a victim of sexual violence as a child, if you're male, can increase your risk of being a victim as an adult. But what it's more strongly correlated to is being a perpetrator as an adult. And so it's one of those gender differences that we think that sociological factors have a lot more to do with as people deal with their abuse as a child. And so one of the things that this survey did was break things down by a person's race. And sort of interesting was that the rate of rape against white and Black or African American women was about the same in the survey. But we did find that being from a non-dominant racial group did increase vulnerability for Hispanic women, American Indian, and Alaskan Native women, as well as those who identified as multiracial and non-Hispanic. So again, this is something that sort of repeats or supports what we have known, that there are risk factors and vulnerabilities that are related to being from a non-dominant racial group that affect a person's chances and possibilities of experiencing rape and other sexual violence.
We have a couple of slides here now that kind of start us down the road of talking about the impact. And we've heard of, we've got some summary things that we can start picking up here, is that the study has shown that females are disproportionately affected by this, that sexual violence starts early in the lives of victims, that we have different rates of experience according to race and so forth. Here's a little bit about the difference in experience with female victims. Female victims of intimate partner sexual violence experience a different pattern of violence than male victims. We have a chart on the next page, which I'll ask Lindsay to go ahead and move to. We see that female victims, and this is maybe a little bit hard to see, are likely to experience multiple forms of types of violence. So you can see in the largest section of this chart is physical violence only. But we do see a significant section of about 12% of women who've experienced rape, stalking, and physical violence. And so the rest of the over 50% of the chart would be experiences of more than one type of violence. So this is sort of a picture of the overlapping of types of violence that female victims experience. Let's look at the next slide, and here's one way that we start seeing a separation of the experience of females versus males. The vast majority of males really report experiencing only one type of violence, and that being physical violence. And again, I would remind you of what Roberta has said about how physical violence was defined, and that an incident of slapping would be recorded the same as one incident of being strangled, for example. So we see that men's experience with this is a much different kind of experience. And we'll talk a little bit later about even how men report the emotional impact or the long-term impact of the violence that they've experienced. And I appreciate Roberta's comment earlier about using the term experience. There's a collaborative group that's been working on the issue of sexual and domestic violence with Native women who have disabilities. And that group caught themselves with the verb experience and thought, don't like that, and so started really trying to change the language to people having been subjected to sexual or domestic violence. But yeah, it's interesting to think about how language can frame how we think about something. We're going to talk a little bit now. Roberta's going to talk a little bit about what the Minnesota data in this report shows.
Okay, so as we said at the beginning, this survey is the first one to give us state-by-state data. However, we need to be very careful with the state-by-state data. This was the first year, again, that it's collected. So in Minnesota, the percent of women who experience rape based on the sample that was drawn, their best estimate is that 22.2% of women in Minnesota have experienced rape in their lifetime. You see under that it says 95% confidence interval, and the numbers after that are 15.7, and that's percent, to 30.5%. And what that means is that if we drew 100 samples, say that 2,000 women from Minnesota were asked questions about this and were in the sample, if we drew 100 samples of 2,000 women that were all different random samples, 95 out of 100 times, our estimate for the number who report experiencing rape would be between 15.7% and 30.5%. And so because this is the first year of the survey, and because there were not actually 2,000 women from Minnesota included, because the total numbers were only 18,000 for all of the states, the numbers are just too low for us to be really confident in that 22.2%. However, we can be 95% confident that it falls between about 16 and 31%. Again, if it was 22.2%, we could say that 452,000 women in Minnesota experienced rape at some time in their lifetime, and you can see the confidence interval with a 95% confidence interval there as well. Being between 285,000 and 618,000, which is quite a span. As we get additional years of data collection, having that larger sample size will give us, will reduce the size of the range in the confidence interval. So it's just the mathematical formula, the way it works out. More data will give us a smaller range. So additional years of data collection will definitely make us more confident in knowing what that percentage is. So we'll go to the next slide. And this one, again, using the same ideas that I talked about before with the confidence interval and the sample, shows the percentage of women who reported being subjected to sexual violence, intimate partner violence, or stalking. And so we see almost 34%, or a third of women, is the best estimate that we have right now, although we do need to be careful with that. And finally, this is the percentage of men who report being subjected to sexual, intimate partner violence or stalking. Nearly a quarter of men, with the interval being between about 16 and 34%.
So being careful with the Minnesota data, I think, is important, and I think you did a great job of explaining the statistical framing of this question. I think that we also can say that doesn't mean that the results of the survey are questionable or not useful. I mean, the larger survey itself gives us some pretty good data to use, but we don't need to think that this implies that the survey is not valuable, right?
Absolutely, right. We just don't want to take those numbers, those best estimates that we have of 33.7% of women experiencing some type of violence, et cetera, as gospel, as the absolute truth that that's how many, because we need to understand it as within a range. So even if you look at the range, however, it tells a pretty, startling, but, well, maybe it's not startling. To some people it would be startling. To us it's not. But, it paints a pretty accurate, with the range paints an accurate picture of how much it happens. And that picture reflects, I believe, what we already know from our work and from previous national data.
I would just add that the coalitions had a conversation across coalitions about the state data. And one of the cautions that, and maybe you were going to say this, one of the cautions that the CDC also said was don't think about taking the state data and trying to compare one state to another, that's really not a valid use of data to figure out that one state has more or less sexual violence, because the data was gathered where somebody is living at the time the study was done, not where they experienced the violence. And the other thing they cautioned about is because of the confidence intervals that you talked about, don't consider comparing male and female victimization data, because it can really skew the state data, because that can really skew or you might be ending up drawing conclusions that don't hold water.
Right, and one of the reasons why that is because the confidence intervals overlap. And so when confidence intervals overlap, it means, the true data point can be in that overlap, so it could actually be very equal, or they could be at the other end of the range, and they could be very, very different from one another. So we just don't have enough information right now to compare across states or compare males to females within states.
So Roberta, we've got a task for you. Somebody has chatted the question. Could you explain the confidence intervals again, please? I'm so glad Roberta is here.
Sure. So the confidence interval is a way to give us a range of where the true number actually lies. And so these data are all based on a sample of women, right, from Minnesota. So the data aren't based on the whole population. Not every single adult female in Minnesota was asked these questions. If they were, we would be able to say, 33.7%, which is on the slide in front of you, if that's what it ended up being. But because they're just drawn, these numbers are drawn from a sample, we have to use statistical formulas to expand what we know from the sample to the entire population. We have to make an inference to the entire population. And in order to do that, we use a formula that gives us an interval so that we know, for example, let's just say 100 because that's easiest, 100 women from Minnesota were interviewed. If from one sample, it ended up that 34 of them said they experienced sexual violence. But if we drew another sample of 100, that sample might be higher or lower, than 33.7%. If we drew 100 samples of 100, a 95% confidence interval means that in 95 of those 100 samples, the number of women who report X, Y, or Z would fall within our range. So would fall with the slide you're looking at within the range of 25 to 42, or 25.6 to 42.8. So 95% of the time, the number would fall within that range. And then the expectation being that 5% of the time it would be higher or lower. I hope that helps.
So the joy will be that over time, when you add more samples, then we would be hopefully shrinking that confidence interval because we've got another group of 100 or 5 more groups of 100.
Right, exactly.
Right.
Mm-hmm.
Okay. Thank you.
Okay, so I think we're on to perpetrators then. And just to repeat again, it's not a study of perpetrators, but data was gathered from victims about the perpetrators in their experiences. So victims were asked questions about who the perpetrators were. And one of the things that we learned was no matter what type of violence we were asking questions about, the majority of people who reported violence said that they had one perpetrator of that type of violence. This did, if you're interested in this, even though it is a majority, the numbers were pretty close when you looked at women reporting the numbers of perpetrators, I believe, of rape and sexual violence. That although it was about 52 or 53% said they had one perpetrator, that is a majority, but then a large minority reported having 2 or more, or 3 or more, or 4 or more. So a large minority, I think I misspoke, a large minority said that. And the majority of female victims, a very large majority, also reported that their perpetrators were male across all types of violence. Males were also the reported perpetrators in when it came to males reporting rape and males reporting other types of sexual violence. The majority of them reported males as perpetrators. And about half the stalking victims of males were also reported males as perpetrators. The one area where males reported more female perpetrators than male perpetrators was the intimate partner violence.
So now we're going on to another part of what the CDC wanted to have as an outcome for the survey, and that was to shine some light on what the health impact of this kind of violence is on the people who have been subjected to it. Conclusions that they drew are that sexual violence, stalking, intimate partner violence are major public health problems in the U.S. That isn't a surprise to us, and I think that in Minnesota we've worked hard to start framing this issue not only as a public safety issue, but as a public health issue. We've worked really hard to bring this into that realm. We also know, and for those of you who are familiar with the framework study, that the first section of it, which was issued by the National Sexual Violence Resource Center, in collaboration with frameworks, they're trying to figure out how we talk about sexual violence in a way that engages the non-experts, that engages the public, because we're all really frustrated with how silent an issue this has been. Well, one of the things that study pointed out is that the public doesn't understand public health issue when we talk about it in terms of sexual violence. What they think of as a public health issue is tainted water, dirty restaurants, not clean hotels, for example. So our work around understanding or helping the public understand this public health frame is really kind of some uphill work that we have to do. But it's critically important because we see in the NISVS study that there's some very good information about the long-term negative health outcomes for victims of violence. What this also talks about is, as we've already heard, but that the violence starts often at an early age. It leads to negative physical and mental health consequences across the lifespan. And it can, this seems like it doesn't need to be said, but I think it's important to say that these can be linked to hospitalization, to lifetime disability, and even to death. Clearly, the health implications are clear. Some of the very specific feedback that the surveyors heard from female and male survivors was that they were, those who had experienced kinds of violence were more likely to report frequent headaches, chronic pain, difficulty or interruption with sleeping, that some of their activities were limited. They had generally poor physical health and reported poor mental health in those who hadn't experienced these forms of violence. And women were more likely to report, this is interesting, asthma, IBS, which is irritable bowel syndrome, and diabetes. Some of the mental health issues that were reported, or other issues specifically, were depression, anxiety, GI disorders, which of course would be the irritable bowel syndrome, substance use and abuse, STDs, STIs, and gynecological and pregnancy-related complications. So we see a vast and a broad array of health impacts that came through on this report. Some more impacts: 3 in 10 women, 1 in 10 men who experienced violence by an intimate partner reported these following. So we're starting to kind of see, I think what's interesting about this, about PTSD, being fearful, the need for health care, whether or not that was accessed or available is not clear to me. 3 in 10 women, but 1 in 10 men reported injury or having had to miss work or school. I think what's significant about this is that we start seeing teased out a little bit a difference between females who have experienced violence and males in terms of the impact. So this is probably speaking to the difference in, well, I'm not a statistician, so I don't know how far I can go with this, but it seems as though the impact on males is experienced as a lesser impact, both on the emotional as well as the physical, than the women are reporting their experiences. So I think that's one place where we start start saying, oh, this is where we see the disproportionate effect on women. And the impact of intimate partner violence, 62% of women who acknowledged that they were victims of this reported being concerned for their safety. That doesn't surprise us. 62% of women said they feared for their safety. 81% who were victims reported at least one negative impact of all of the different kinds they could report. So a really high rate of impact of those who reported that they had experienced intimate partner violence. Sort of in contrast, 16% of men who identified they were victims of IPV indicated they were concerned for their safety. So in my mind, this goes back to the conflict tactics scale and the kind of violence that was used, and perhaps maybe this is hinting at the context of the violence. 35% of men victims of IPV reported at least one negative impact. So you see the variance in impact depending on gender is pretty significant. And so from Roberta now we want to hear, how is this report different from other things we might have heard from?
Okay, and I think most of the things on this list may have been mentioned earlier, but one of the things, it's different than any sort of crime report survey or anything the FBI might do, for example, because it uses behaviorally specific language. So it doesn't ask people, it doesn't go to police departments and ask for reports of crime. It doesn't ask people if they were raped. For example, it asks people something like, have you ever had sex even though you didn't really want to because somebody forced you to do so, or something like that. And the exact wording of the survey questions is included in the report if you're interested. It also includes drug-facilitated and incapacitated sexual violence. And that's not necessarily true. And a couple other studies have included that have been done on college campuses, but not all of the studies, the violence against women studies have included those. Also, it's different from those studies that I talked about that have been done on college campuses because penetration by coercion does not equal rape. It equals other sexual violence in this survey. And then it uses this new category of forced to penetrate and does not count that in the rape numbers either. And so these are some of the things that make the survey different. As I said before, it also contacted people by their cell phones as well as their landlines, conducted the survey in 2 different languages. And so, probably this survey probably is the best data that we have so far on these questions. So let's see, I said this English and Spanish. It's hopefully going to be different as long as funding keeps going for it, that it will be done on a yearly basis, and we have state-specific data. And then finally, although not included in this report, it does have data on special populations such as veterans, people with disabilities, and data based on somebody's sexual orientation. We know, of course, that veterans and people with disabilities, at least from the research that's out there that may not be done on a national scale, that these groups report, especially female veterans, very high levels of sexual violence and other violence in their lives. And so it will be interesting to see once there are enough people in the sample who identify as a veteran or someone with a disability, or someone other than a person who identifies as heterosexual. Once we get the numbers high enough, they'll be able to release some of the data related to those populations. There are definitely some limitations to this study. We talked about the fact that it's the first year and that the state data is less reliable because the numbers are lower, the sample size is smaller, and thus the confidence interval is much larger. Also, this study only reached people who have phones, and as you can imagine, the list of people who do not have phones, you can see it there: homeless, living in shelters, incarcerated in treatment facilities, in poverty and can't afford a phone, though that might as well be a list of risk factors or vulnerabilities to sexual and other types of violence. So again, we know that those who are probably the most likely to experience these types of crimes were not included in this survey as respondents in the survey.
My favorite part of our conversation is this one. Go ahead, Roberta.
Okay. You may have been following some of the writing about this report after it came out. There's been a bit of a backlash against the report by some, I guess I'd call them the usual suspects when it comes to this issue. But just because these may be things that you run into in your communities, some arguments that you run into that people have about, why this report shouldn't be considered valid, or that this report is overblowing the problem. The first of these is this idea that the agency's figures are at odds with official crime statistics, and the fact that the FBI, for the same year the study was done, found that there were 84,767 rapes reported to law enforcement. And if you recall, I think it was 1.3 million women, that doesn't even include the men, who reported 1.3 million women, according to this report, experienced rape in the last year. So that's sort of the backlash statement. And then we have our why it's nonsense. The statement is true. There are definitely fewer reports made to police officers and to law enforcement than there are actual incidents of this type of violence. The statement's true, but the purpose of this study is to count the number of people who've experienced or been subjected to violence, not the number who make police reports. So we would expect the numbers here to be much higher than what the FBI would report, because, as we know, rape is the most underreported crime that there is. The second sort of backlash idea is a question about how the questions are asked. So this is actually from an article that said, instead of straightforward questions such as "Have you been raped?", the Centers for Disease Control described a series of sexual encounters, and then they determined whether their responses indicated sexual violation. So the answer to that sort of backlash, again, is yes, that's true. That's what they did. But as explained earlier, using behaviorally specific language is the gold standard for survey research. So, for example, if you're trying to assess whether or not somebody is an alcoholic, you don't ask them, "Are you an alcoholic?" You ask them behaviorally specific questions. You say, "How many drinks do you have in a day? Has alcohol or your response to alcohol ever interfered with you getting to work on time? How many times have you been pulled over for drunk driving? Does your husband, wife, or partner believe that your drinking is an issue?" So that's exactly what we do in social science. We ask behaviorally specific questions, and then depending on how we define alcoholism, we put people in that category or not. We don't just ask people to put themselves in a category, because then our numbers would be woefully, woefully low and inaccurate. Okay, and then the final sort of backlash was this idea that sexual coercion was included as a category, including things like pressure by someone's telling you lies, making you promises about a future, and that these were counted as sexual violence. So there are some people who believe that these types of things should not count as sexual violence, that coercion should just be left out of the whole violence picture because it doesn't involve force. So again, this statement is true. Coercion did count as sexual violence, but please remember that those 1 in 5 women experiencing rape in their lifetimes and 1.3 million women experiencing rape in the U.S. in the last year does not include coercion. It only includes penetration by force or attempted penetration by force. Sex by coercion is called sexual violence, and about 13% of women reported that they experienced sex by coercion. They are not included in the 19% figure or the 1 in 5 figure related to rape in the last year. I definitely think it's a good idea to have a civil conversation about what our definitions look like for rape and other types of sexual violence. That should definitely be something that's dynamic and changes as we continue to learn more about how these things unfold. But the idea that the survey is bad because of these sort of backlash ideas around definitions and the way it's counted, it's really nonsensical to me that these really don't hold any water. Interestingly enough, when it comes to coercion, as I said before, is that this whole idea of coercion has been counted as rape in former studies that have been done, but it was not counted for this one.
Okay, let's bring us around to the conversation about prevention. If you recall that in the framing of this that we talked about early on, the CDC's vision was that when people better understand the nature and extent of the problem, they'll use that knowledge to strengthen and support prevention efforts. And so we're at that point of, if we internalize this data, understand what it says, understand the health implications, then it sets us up to really start looking at prevention. And they give us several sort of directions about prevention. One thing they talk about is prevention in families, that prevention efforts should start early. Now, we hear people saying, oh, it should start early. It should really start with kids in middle school. And then we all kind of chuckle a little bit, and then somebody else says, oh, it should start in grade school for sure. And then we hear somebody say, oh, it should start in kindergarten for sure. Well, we know that prevention needs to really, to be effective, to have that framework for perpetration prevention and for developing healthy children needs to really start probably while the child is in utero. It has to do with a lot with how families are constructed. What they talk about is we should be promoting healthy, respectful relationships in families, and that would be parent-child relationships as well as parent-to-parent relationships, and helping families develop positive family dynamics and to be emotionally supportive. And while that's wonderful, and that really is the prescription for prevention, you know, what I would point out is that it's a great vision, but we know that families are living in our society and are living with a lot of stresses, with a lot of economic stresses. This doesn't really give space to talk about the role of poverty and the role of racism and some of the other issues that families face. And we know that there are many, many norms about parenting and healthy relationships that are confusing, that confuse the issue. But families are really core, and if we can find ways of supporting families and giving them the resources to do this, it is a great vision. And so that's one place to think about focusing our efforts on prevention. So the larger area of prevention outside of the family is also of really great interest to us. For those of you who are familiar with a social ecological model, you know, sort of envision an individual nestled inside a family, the family nestled inside a community, and the community nestled inside of society. All of those levels have huge impact, ultimately down to the individual. So we, you know, thinking about how we work beyond the family to address the beliefs, attitudes, and messages that really create the environment within which sexual violence has been kind of normalized. Now, this is language directly from the report. This is what the NISVS report says, is that in order to work on prevention, we really need to address norms change. We need to address those things that reinforce the negative stereotypes of what it means to be a male or a female, and the norms that objectify and degrade women. And again, that is CDC language, the norms that objectify and degrade women. We need to be taking a look at what policies need to be changed or need to be strengthened to enforce existing policies against violence. So very often there are policies in place that are ignored, that aren't doing what they need to be doing. And to think about how we create an environment where bystanders' standards feel empowered to speak up and to intervene. When the norm becomes, so think about smoking, when the norm becomes, I can ask Roberta to quit smoking the cigarette because I don't like the smoke in my face, how do we move from that being a rude thing to do, from now that being a normal thing to do? The same kind of bystander empowerment change needs to apply here. When I think about in the 60s when it was normal to discriminate against people because of the color of their skin, so much so that policies were put in place to ensure that discrimination continued. That's the kind of norm change that has happened around some of the civil rights work. We're not entirely where we need to be, but it's a similar kind of norms change that needs to happen around masculinity and around the value and role of women in our society to stop sexual violence. Some other implications that the report points out, and I think all of these are really powerful for us to take to people and to leaders in our communities, to the public in our communities, to say, this is what the CDC says can help us all. So what they also say will support prevention is making sure that there are services available for victims and that they are well coordinated within a community. So this really speaks to and gives a nod to those critical advocacy services that you all are representing on the call here. The other thing that it says is that we need to be sure that those who are perpetrating sexual violence are held accountable, laws are enforced, that victims have a voice in the process, whether it's a civil or criminal process. And I think also we can extrapolate from this that we have systems that work effectively and in victim-centered ways to create this kind of accountability to victims and holding those who have perpetrated sexual violence accountable to victims and to communities. And the third implication in this section is also to ensure that we continue to have strong data collection systems and that those systems are implemented. For a number of years, we have been saying here, if you don't count it, it must not be important to you. And in fact, in Minnesota, we have not had a system at all of counting the prevalence or incidence of sexual violence. For the last at least 2 years, and it might be 3 years, the MnCASA public policy agenda has included an acknowledgement of this, and we are working to have the legislature direct the Department of Health to establish a plan and to report back to them a plan for doing statewide data collection that could support or illuminate some of the state data that we've already gotten from NISVS. So the CDC's conclusion in all of this, you can read that for yourselves. I will just point out in the last sentence the things that really grab me are that these kinds of violence can be prevented. I think we live in a world that thinks this is so large and it's gone on so long there's nothing that can be done. I had that experience at my precinct caucus last night. Can anything really be done? The CDC says yes, it can. We've figured out other ways to address at its core some major public health issues, and we can do the same with this kind of violence. We can do it if it's data-driven solutions and if it's collaborative. And collaborative, I think, means bringing in as many voices, because we all who work in this area know that sexual violence affects, we've heard of the health outcomes that are pointed out in this report, so we know that every healthcare provider should understand their role in addressing prevention and figuring out how they might become part of the solution. The schools should be. Anybody who runs a business can understand or should understand how this affects their bottom line. We know that that the collaborative nature of the solution is really critical for making the kind of change that we need to make. So we're going to, I've just got a few slides that I've added in here because it seemed to be coincidental and a lovely happening. We had two major things happening right at the end of 2011 that address a larger interest now in understanding the scope and magnitude of the issue of sexual violence. And so while we have really kind of covered all that we intended to cover with the NISVS report, we've added a couple of slides here about the new definition of rape that has been put in place in the Uniform Crime Report. That's the UCR, which is a data collection system that the FBI maintains. Now, these are reports that are related to law enforcement intervention. So this is not, self-reporting, but it is a reporting mechanism that has been set up to allow local law enforcement agencies to report to one general place about the nature of crime in their community. So this new definition has come out. It's coincidental to NISVS, but it's really important that both of these major sorts of issues around data collection have occurred at once. I cannot stress how long overdue this is. The definition that up until December of this year they had been using was drafted in 1927. And when you think about how much we have redefined and expanded our understanding of sexual violence since 1927, it is amazing this definition held on as long as it did. It was, quote, the carnal knowledge of a female forcibly and against her will. So you see the problem. This was really about forced intercourse, female victim, male perpetrator, forced penile vaginal penetration. And so it really, thank you. So, that's okay. So Lindsay got all excited about the new definition. But so you can see that we were capturing such a narrow number. It didn't really reflect reality at all. I recall working in a community, and we would blanch that once a year when this UCR data was reported in the front page of the local paper, and in spite of the fact that we saw 300 to 400 new victims every year, the headline was there were 12 rapes in the county last year, and it's like, oh no, there were many more. But that was the UCR, that was the UCR number. So here's the new definition, and it accomplishes quite a bit. What it says, how it defines rape, is the penetration, no matter how slight, of the vagina or anus with any body part or object, or oral penetration by a sex organ of another person without the consent of the victim. So we know, this is a much more descriptive definition that really covers what we understand as the broad range of rape. It is gender neutral. No longer does it have to be a female. And the lack of consent includes temporary or permanent incapacity. So they're talking about being incapacitated because of a disability, perhaps, or perhaps being temporarily incapacitated by drugs or alcohol or some other condition. It doesn't require physical resistance by the victim in order to be identified as rape. It reflects, as we can see, new state and federal law changes regarding rape. The one sort of area of concern that I think that we have is that the implementation, according to the FBI website, is, it's not that it has to be implemented by January 1 or by December 31st, but as resources allow. So that, we know that every law enforcement agency, state and local agency, will have to redesign its data collection system to be able to fit this definition. So that's going to be a problem. Somebody wants to see the new definition again. Let's go back to that. Okay. Again, this is really relegated to adults. So this isn't collecting information about children. The UCR does have another category where they capture other sex crimes. So that would capture touch or contact crimes. I think that also lumped in that are some other things like recruiting somebody into being used in prostitution and so forth. There's also a category of child abuse, but I don't think it separates out child sexual abuse from other kinds of child abuse. So it solves some problems. It still leaves some gray areas that we would like to have clarified a little bit more. So that brings us to this. We have 10 minutes left, and we have thrown a lot of information at you. We really invite you at this point to well, we could unmute everybody. Can we unmute everybody? And allow people to voice.
The conference has been unmuted.
Voice in some questions or continue to chat questions if you have them. And we're very interested in whether or not you think that you can shape some ways of using this data to help your community understand the nature of and the prevalence of sexual violence as this report has shown. Uh-oh, we've got some music. Somebody must have put us on hold. Any questions? Okay. All right, we're going back to mute all because of
The conference has been muted.
So if somebody would like to speak, can they just unmute their phone?
Or they can raise their hand.
Raise your hand. And while we're waiting, let's also just note that there is a link on this page to the site where you will find the really great data and really great materials from the CDC to help you work with this. What's that? Oh, copy of the PowerPoint. Yes. I thought I had attached one to the, let's do this. I thought I had attached one of the handout. But why don't we send a copy of the PowerPoint, because we would invite you to take the PowerPoint, maybe use pieces of it if you want to do a local presentation in your community. We'll keep this webinar available as a podcast, so if you want to go back and listen again to Roberta's description of confidence intervals.
Nothing more exciting than that.
But sure, we'll send you, we'll make the PowerPoint available so that you could use it or use parts of it to show. And we'll also have make the webinar available as a podcast so you can listen again to the commentary that's gone along with the slide. Any questions? Any comments? Anything that you were hoping to hear that you didn't hear? Well, I thank everybody then for joining us. I would, what was, again, with the, okay, what did the big number 450,000 refer to? And you don't have to be sorry for asking the question. We love questions.
Yes, thank you. So I think you're referring to the slide that says Minnesota data, women who report experiencing rape. And that slide said that 22.2% of Minnesota women reported experiencing rape in their lifetime. And then it gives the confidence interval for that, which is between 15.7% and 30.5%. But the number underneath that is 452,000. And that's the number of women in Minnesota who essentially are 22.2% of the women in Minnesota equals 452,000 women. So if the 22.2% is accurate, we know it's an estimate, but if it's accurate, then that means that 452,000 in Minnesota have experienced rape in their lifetime. So that's what that number represents.
But because of the confidence interval, it could be as few, quote unquote, as 285,000 or as many as 618,000. So this points out how why we have to be really cautious about citing Minnesota data, because it could be, if we say 452,000, well, that's halfway between the range of possibility given the data. So, and again, I think if you use this Minnesota data but qualify it, be really clear that this doesn't indicate that the NISVIS study is not a valid and a good study. It's just the state data didn't have enough, and it's, in fact, some states didn't have enough data to even come up with with an estimate, like ours. So they didn't have enough people captured in the study. So use it cautiously. Explain what the Minnesota data is and isn't, but don't let it cast a pall over the rest of the findings of NISVS. Good question. Well, unless we hear any more, we'll go ahead and let you go 5 minutes early. And I just want to thank tremendously Roberta Gibbons for joining us today. It's really fun listening to her ease with talking about data and talking about research. It was a real benefit to us to have her. Oh, somebody's got, Jean has a hand raised. Yes, Jean. Oh, we're going to try to figure out how to get you. Okay. Are you there? Why don't you unmute everybody and then we can hear Jean.
The conference has been unmuted.
Go ahead.
I'm sorry. I didn't know if I could do it over the music, but it seems like it went away, huh?
Okay.
Okay. Sorry to keep us, but I found myself thinking a lot about the male data, and I don't know if anyone else had that same, wonder or query about the male data. And if I just wanted to check something out with you, Roberta, perhaps, about whether you think that the male data might be further confounded by, as you said, if you have an experience of victimization, you may not be completing the survey. And I'm thinking of Dr. David Lysick and about, male victims reporting at greater underreporting among male victims. So I just find myself wondering about the male data. Is there any talk or about that issue?
And when you say you find yourself wondering, or do the numbers seem low to you in terms of males who've experienced rape? Is that what you mean?
They don't. I just don't know if I'm confident. The numbers seemed high as far as the overall intimate partner violence, and then lower in regards to rape. And I just don't know how much confidence to look at that whole number. And I also think about this unfortunate and very low number of calls that we might receive to our crisis line from men who are purporting and sharing experiences that we later learn are, that we can learn from the conversation or from the frequency of their calls that there's something else going on there and they weren't actually experiencing what they're sharing. You know what I mean? It's like a prank call, basically.
Right, yeah.
So I don't know of course we don't know if any respondents could have had a motivation of that sort in responding affirmatively, but...
Right, and there's always a question with surveys. The model that was used for this is probably, as I said, the gold standard for the way questions were asked. And it's sort of believed that that to some extent, the people who exaggerate their experiences and those who don't remember them well enough or don't want to fully disclose, that they sort of cancel each other out, and kind of with the idea that the number you get is still pretty accurate. But it's certainly the case that when you're using behaviorally specific language, you are less likely to rule out true victims than if you were to just ask men, for example, have you experienced rape? And another big change in this is this idea of being forced to penetrate. So men who were raped by other men would be counted in that 1 in 71 statistic, 1 in 71 men reporting rape in their lifetime, which I think might seem low to people. But there's this other category called forced to penetrate, where we could look for it and read you the definition, but when you read the definition, it feels like that's the category for men who are forced to have intercourse with women against their will, which I believe would previously have counted under the rape category for much of the earlier work that was done. And so now there's this new category called forced to penetrate. And the numbers there were also low. But if you add them together with the numbers of rape, it would, add up to a total that might look more like what we would expect. But yeah, again, I mean, it's hard to say. I mean, the data don't tell us why numbers are high or low. They only tell us that they are.
Thank you. That was helpful.
I don't know. Okay.
I think that's a great concluding statement from Roberta. It's like we've got this data. It doesn't really tell us why it does, and so that's an interesting part, I think, of understanding the really meaning of NISVS. But it is important data, as we heard from Roberta. This is one of the best studies that we've ever had to work from. We hope that the future administrations will continue to support the CDC doing this study. So wouldn't it be wonderful if 10 years down the road we had 10 years of collected information? We know that they've already done the next survey, maybe even the next 2 years of questioning, but they have not yet analyzed that data. They'll start doing that now. So the next chapter will be coming. So thank you very much. If you continue to have questions, you can see Roberta's email address there. Feel free to email her. You can email me, and then I can pass the email on to Roberta if I can't answer your question. Thank you so much, everybody, for joining us.
Thanks for having me, Donna.
Yeah. Bye-bye.
Thank you. Please stand by.